I am Dr. Amitabh Varma. Though we deal with all the topics, all the specialties of neurosciences, all the problems in neurology, but today I'm going to tell you more about migraine, which is a very common headache, very common. It affects more than 10% of the population. Some say 6, some say 17. So I'm giving you an average of 10%. In my practice also, it's about 10%. Now, it's not so very common, but more commonly misunderstood. It is not only one side of the head which should pain in migraine, but it can be both the sides of the head. Not only the head, but the neck area also pains with that. With the result, people misunderstand it for changing in the spine, in the cervical spine. The pain is very interesting to tell you. For me it is interesting, but for you who are the sufferers, that brain itself, this brain itself in front of me is painless. It's like a khajanchi, it's like a treasurer who deals with the crores of money but doesn't take himself. But the painful structures are these blood vessels and these membranes over the brain, which are painful. These are all controlled by a center of a nerve, brain nerve, which is cranial nerve, fifth nerve. It is known as trigeminal nerve. This also supplies to the head, forehead, and the back side and neck side, and also to the eye. Impulses come here and it gets stimulated and produces these blood vessels to widen and stretching the nerve fibers, so you get a pain. Why it gets stimulated? There are many factors for it. Usually at times within the brain, electrical changes occur and stimulate it. It's too technical for you, but good to understand that the brain changes like sleep, emotional stress, hunger, they all bring about precipitation here. Now when the pain occurs, it produces in the neck also, head also, and there is maybe tenderness in certain areas of the nerves which are emerging out or entering the brain through the skull. These painful states have to be associated, to be called as migraine, with either a phonophobia or a photophobia. That means the person is uncomfortable with the noise, tries to shun away the noise at the time of the headache, or is uncomfortable with the light, would like to lie in it, dark places. Irrespective of the intensity and irrespective of the one side or both the sides, but it can produce a headache, and it need not be accompanied by vomiting, but if it is done, it is welcome to diagnose it that way also. Depending on what area of the brain is being involved, you get auras, and if this area is involved, you can even vertigo. Vertigo can also come with that. The nerve findings can also produce pain in the neck area, shoulder area, along with that. And the eye strain produces irritation of the nerve, same nerve which is arising from here. It is also part of the same nerve. So it gets stimulated and you get a precipitation of the migraine attack or triggering of the migraine attack. Now, having known what is it, it can be stimulated, triggered by the rest of the bodily dysfunction, whether it's from the tummy or it is from the speaking, it was the emotional state, or any other dysfunction. It can produce triggering and migraine. Then we must know how to control that. The two types of control is that one is attack when it occurs, how to treat it, and the attack in between, the different type of changes which have to be treated in a particular manner. So we will be giving, depending on the individual patient, what has to be given and what is not to be given. We used to call it cheese, red mixed cheese and Chinese food. All that is their precipitating factor, but it is not always in every person. Every person has a different factor. Nowadays the current concept is also coming up as a gut-brain axis. Whatever is there in the abdomen gets liberated and produces changes in the brain center for the pain, and the pain gets aggravated. Why should we treat it? Usually people say we can take a painkiller, we sleep down. Once in a while it's all right. If it occurs once in 3, 4, 6 months, you can take one painkiller and be out. out of it. But if it is recurring again and again, then it produces some changes. Now it has been shown it produces changing in certain areas of the brain, especially the pain controlling circuit of the brain. And the memory circuit and the behavior circuit, all these get affected. People have more predilection apart from the loss of memory or means abnormal functioning of the memory system. People also have behavior changes. They also get, their quality of life gets changed. They are not able to write well, they are not able to concentrate well because these recurring attacks of migraine. That's why we ought to give preventive treatment for that. Preventive treatment for each individual is different. We have to decide what has to be given. We ought to investigate the person from a totality point of view, including certain imaging studies. Not in every person, but more for reassurance. So please do not neglect your migraine. It is very tricky thing, and there are many migraine mimics which look like migraine, but they respond differently to another thing, like episodic migraines. Or apart from episodic migraine, you have a migraine-like thing where the eyes changes occur, the head changes occur, which look like migraine, but they are different and we require different treatment. So please do not hesitate to consult us in our hospital. We have a totality under one roof to take care of it. Thank you.